So we have Hillary over here, who's our wonderful nurse injector, who's the most loved injector, voted several times. And I have the honor of actually injecting her today. I'm going to be starting off addressing several things on her face and trying to rejuvenate the lower face. She has already had fillers in the upper face and the cheeks area, so we're going to concentrate more on the lower face. I'm going to start off with the lips, and we're going to be injecting our Restylane Kysse, which is the newest filler on the market. It has the expression technology, which means that it has the incorporation with the normal tissue that's there. The lips on the face is something that is the area that moves the most in our face. With all the expressions, every talking that we do, nothing in our face moves as much as our lips does. And we want the filler to be really integrated with the tissue to make it that natural, soft look as lips move. We don't want something that's very stiff in there that makes the lips look unnatural when we're expressing or we're talking. So with this technology, it really integrates well with the natural tissue. It moves with the tissue, so it gives that really nice integrated look. And on Hillary, she has a little bit of asymmetry where on the upper eyelid, on the upper lip, her right side is a little bit less full than it is on the left side. So we're going to be injecting this in order to correct the asymmetry, and we're going to be plumping up her lower lip a little bit more today in order to give her a good look. I had injected her filtering columns before, and she still has that in there, and it's integrated, so we're not going to be redoing that. I will put a little bit more in the pout right over here to give her a little bit more fullness, but at the same time, when I'm injecting the lower lip, I will leave the central area a little bit more empty, so this fits like a lock and key. So for injecting and providing more of a lift and fullness, most people think that we would inject along the vermilion border in order to get that, but that's when, if injected along the vermilion border and too much is injected, people get that duck lip look. So I do not inject the vermilion border if I just want the fullness and the red show. Instead, I go to the junction of the wet and the dry mucosa. That's where I inject in order to give more of a red show. So here we go. We're going to start laterally. And inject coming retrograde. And I'm very conservative at putting this in. I can always go back and inject more. If I put too much in, it's not like I can go back in and just remove a little bit. There are multiple ways and multiple techniques for injecting, and you got to be aware of every single one of them and tailor your injections to what the patient wants and what the patient needs. There's not one technique that would work uniformly for everybody. And therefore, by knowing all the techniques and knowing when to use what, we can really give the patient what they need. So I injected that a little bit, and I'm looking. Go ahead and close. I have a little bit better symmetry right now, but I think I still need a little bit more on this side. So I'm going to go and inject a little bit more. And notice that I put a little bit more right here in the centrally. I'm going to do that a little bit more. close. Great. Now I'm seeing that the upper lips are completely even, and it looks great to me. Good. Okay, open. All right. And that was total of 0.25 cc's that I just put on that side. So it doesn't take much in order for you to get good results. Okay, and now I'm going to be injecting the lower lip. Open up a little more. Again, junction of the wet and the dry mucosa. I'm going to keep off of the central part, so I'll move my needle back. Good help?
Good. Great. Can't feel the thing.
So Hillary has had a lot of numbing medication put on her skin in order to help with the pain of the injection, and that along with the nerve block that she got kind of elongates the lip, as she can't feel her lip right now. Normally it's looks better, she's got great filtering column, but another thing that I noticed is that she does not have much of a fullness in her white roll. So we're going to build up the white roll for her just a little bit over here to give her that fine fullness in the junction of normal skin with red lips. But we're not going to overfill that, because if we do, then that really projects out, and that's what makes it look really fake and, in my opinion, not good looking. There's a natural well right there in the white roll, which if you're in the right plane, it really takes that filler well and keeps it there and makes it look great. There we go. A nice little white roll enhancement right over here. Again, my goal when I'm injecting it is for her to look very natural, that she doesn't step out over here and everyone in their family is looking at it and say, oh, she just got her lips done. It's something that looks natural. It enhances her natural look, but keeps it to the point that it's not obvious that she had something done.